Hello. The purpose of this video is to introduce the basics about disposable medical gloves. The key word is basics. In this video, we will go over the main characteristics. Let's start with the fact that there are two main types of medical gloves, depending on how they are used: surgical gloves and examination gloves. We know from medical history that there are two important modern inventions: medical gloves and medical masks, which are now commonly referred to as PPEs, personal protective equipment. A bit of history. The first medical gloves were made out of sheep's small intestines, and they were used by obstetricians and gynecologists. It wasn't until the year 1900 that natural latex gloves were used for the first time in history. And they became ubiquitous in general medical practice. There are 5 main differences between surgical gloves and examination gloves. First, the raw material, what the gloves are made out of. Second, sterile gloves and non-sterile gloves. The third difference, packaging. Fourth difference, the properties such as shape and length. And finally, size. Let's look at each one of these separately. First, there are 4 main types of raw materials, meaning 4 main types of glove material: latex, nitrile, vinyl, and vitral. Latex is a material which is obtained by processing the white, milky sap of the hevea rubber tree. Hevea trees grow in the rubber belt countries close to the equator: India, Indonesia, China, Malaysia, Thailand, and Sri Lanka. The latex production process is quite labor-intensive. An incision is made on a tree at one time of day. Then, the sap is collected from this incision at another time of day. It is collected in cups. Then, the sap is taken to the production facility, where it is poured onto molds, and this is how the gloves are made. Like we previously said, since the gloves are made out of the hevea tree sap, they are natural and environmentally friendly, and they are biodegradable. Now, if we look at their properties, the reason why surgeons all over the world value these gloves is because they are very thin, and they provide maximum tactile sensitivity to the surgeons. They are very flexible and very durable. As for chemical resistance, later on, you'll see a table that contains a comparison of characteristics for all types of gloves: chemical resistance, tear resistance, and elasticity. We should also mention, regarding the application of latex gloves, that they are mostly used in medicine. This includes surgeries, physical patient examinations, when using various equipment and technology, preparing mixtures, and disinfecting rooms. Also in beauty clinics, dentistry, pharmaceutical companies, in industrial productions of cosmetics and food products. It is important to note that Dolce-Pharm's latex gloves bring down the risk of allergies to a minimum. Because, as we said earlier, hevea juice can cause protein allergies in those people who are predisposed to this allergy. However, we only sell Dolce-Pharm latex gloves made out of high-quality latex. There are some distributors in the market who sell gloves made out of residual latex. Also, conducting the full rinsing cycle is very important for latex quality. The more cycles a latex glove goes through, the lower the risk of allergies. We can also put it this way: unrinsed gloves from unscrupulous manufacturers can cause higher risks of an allergic reaction for a very large number of people, whereas gloves made out of good quality latex that underwent the full rinsing cycle can only cause allergies in people who are highly allergic. Nitrile laboratory gloves. Nitrile gloves are made out of an artificially synthesized rubber that is an alternative to natural latex. Because it is artificial, it does not decompose in soil. However, there is a big advantage. It is completely hypoallergenic. And so, nitrile gloves are best suited for people who are prone to protein allergies. They are more durable compared to latex gloves, and they provide a good grip when holding objects. And another good feature of nitrile gloves is the variety of colors. You can see blue and pink here, and more colors are available. The color range was originally introduced to help control the glove replacement every 3 hours. Glove replacement control. Why does this matter and where are these gloves used? First of all, in medicine, of course. These gloves create an effective barrier against the penetration of pathogenic microflora. Also, in laboratory research, because as I said earlier, they are chemically resistant. And in the chemical industry, beauty salons, cosmetics manufacturers, in modern nanotechnology, construction work, and even in the woodworking industry, the usage range of nitrile gloves is very wide because of their properties. Speaking of color, why the different colors? Because originally, the color range wasn't introduced for aesthetic reasons, but rather to control the glove replacement every 3 hours. Going back to beauty salons, dentists, and so on, everyone who uses nitrile gloves should remember that they must be changed regularly. Studies have shown that in beauty salons, the same pair of gloves may be reused, instead of being disposed of after a single use. We'll come back to this at the end of our video when we talk about the culture of glove use and application. Vinyl gloves are made of polyvinyl chloride. This is why they're called vinyl gloves. As they too are of artificial origin, same as nitrile gloves, they are not environmentally friendly. They're not biodegradable, and they also don't cause a protein allergy reaction because they do not contain any proteins. A salient feature of vinyl gloves is that they have large pores, which become larger over the course of time. For example, if you fill a vinyl glove with water and leave it, the water will completely leak out overnight. One advantage is that vinyl gloves have the lowest price compared to latex and nitrile. When are vinyl gloves used? Vinyl gloves are used for physical examinations, for quick, non-invasive procedures where the skin surface stays intact, because like I said earlier regarding the pores, since vinyl gloves have larger pores, after a while, any pathogenic form is able to penetrate them. Therefore, they are safe to use only when skin surface stays intact. This means vinyl gloves may not be used if skin surface is irregular, if there is blood, discharge, and so on. Vinyl is very popular among food industry workers. There's a trend in fast food restaurants to eat with vinyl gloves, usually black-colored, and other colors too. Cleaning services prefer vinyl gloves. All of the beauty industry as well, wrapping, manicures, coloring, and so on. There is a new material on the market called Nitrile. Nitrile is new on the market, a combination of nitrile and vinyl. Accordingly, the characteristics are similar to nitrile and vinyl, and it is mainly used for the examination of newborns and by medical personnel who are allergic to latex. These are the cases when nitrile gloves are used. Here's a comparison of characteristics by raw material for natural latex, nitrile, vinyl, and nitrile. The table is now visible on your screen. The next comparison, sterility. Previously, we looked at the first difference between surgical and examination gloves, the raw material. That is what the gloves are made of. The second important difference is sterility. Surgical gloves are always sterile. Examination gloves can be both sterile and non-sterile. So it's logical to assume, and we assure it is so, this is reflected in the packaging. Sterile gloves, both surgical and examination gloves, are packaged individually, whereas non-sterile gloves come in boxes. Dolce-Pharm boxes contain 50 pairs or more. The fourth difference is the shape and length. The shape can be bilateral. Let me demonstrate using these vinyl gloves. Bilateral means there is no difference which hand you put them on, right or left. So the glove will feel absolutely the same on either hand. If we take surgical gloves, latex gloves for example, the shape is strictly anatomic, which means they are shaped to closely imitate the anatomy of a hand. This means the thumb is placed accordingly for the left and the right hand, which is more comfortable and convenient for surgeons. As for the length, examination gloves start at 24 centimeters, and surgical gloves start at 30 centimeters in length. The fifth difference is the size. It's pretty simple. In examination gloves, the sizes are the same as in clothing, from extra small to extra large. A total of 5. XS, extra small, S, small, M, medium, L, large, XL, extra large. Surgical gloves come in 10 sizes because a surgical glove needs to fit the hand more accurately. There are 10 sizes, starting with 5. 5 to 5.5, 6 to 6.5, 7 to 7.5, 8 to 8.5, and 9 to 9.5. How do you measure your glove size? The glove size is measured by taking the circumference of the palm without the thumb using a tape measure like this. Here. As you can see, my surgical glove is a size 8. So, we have just looked at the 5 main differences between surgical gloves and examination gloves. These are raw materials, sterility or non-sterility, packaging, shape and length, and size. Right now, I'm wearing an examination glove and a surgical latex glove because they have another factor in common: surface treatment. Surface treatment can be internal as well as external. Treatment with powder, which you might find on surgical gloves as well as examination gloves, can be done with either cornstarch powder or talcum powder. What is the purpose of this? To ensure that the gloves are easy to put on and to keep the gloves from sticking together. But treatment with powder has become outdated. Why is that? Because a new term has emerged: glove smog. Let's say there are several people in the operating room. Usually it's an operating surgeon, a nurse, and an anesthesiologist. They all take their old gloves, put on the new ones, and all that powder, talcum, or cornstarch stays in the air. Then it settles on the operated area of the patient, which can cause risks during surgery and complications in the post-surgical period. So now there is a newer, more popular technology, chlorination. The chloric acid treatment is now replacing the treatment with powder. Chlorination can be single, that is, when the gloves are treated on the inside only. This is true for Dolce gloves. And double chlorination is when both the outside and the inside of the glove is treated. I'll reiterate that Dolce-Pharm gloves are only chlorinated on the inside, because performing a double chlorination, as many on the market like to do, may cause micro defects in the glove, and the glove ceases to protect, therefore losing its main function. The outer treatment is texturing. Both examination and surgical gloves can be textured. What is texturing? Gloves can be externally smoothed or textured, meaning they'll have ridges. This Dolce glove here is textured, meaning it has ridges on the fingertips. What is this for? To provide a better grip for surgeons when using surgical tools. Now, on Dolce's culture of using disposable medical gloves, although we recommend this culture for other disposable medical gloves as well. First of all, gloves should be strictly used for their intended purpose, depending on the raw material. Remember, we talked about vinyl, which has pores and where it can be used. We talked about latex and others as well, because hepatitis B, C, and HIV infection rates are very high amongst medical personnel, and in the cosmetology industry, it is very important to know what material gloves you're wearing and when to use the gloves. Then, there are different hazardous situations. For example, when there's no time to do the tests before receiving or treating a patient, or emergency situations, such as a broken syringe that contained blood. In this case, 2 pairs of gloves should be worn. First, nitrile ones, the laboratory gloves, and then the latex ones, surgical gloves, which are elastic and stretch well, as I said before. Latex will reduce the force force of the puncture, and the latex glove, because of its elasticity, will retain the blood from the syringe. Therefore, these two gloves combined together will offer more protection. Second rule, gloves should be worn only on dry hands, not on wet or damp hands, because damp and wet environments are breeding grounds for germs. The third rule of Dolce's glove culture is to remember that they are disposable gloves. Unfortunately, most people take this to mean one-day gloves. So they take the gloves off and put them on again. After putting them back on, they also wash them or treat them with antiseptics. This is absolutely not allowed, because the disposable formula is very clear. Put them on, take them off, disinfect, and dispose accordingly. To stress what I said earlier, you should not put them back on, wash them, or sanitize them. This should be obvious. Treating gloves with an antiseptic will cause micro fissures and therefore weaken their main function, protection. And another very important point, choosing the correct size. Gloves should not be too tight on the hands because the surgeon's hand should not become numb, which is applicable for a beautician as well. So, it is important. So today, we went over the basic characteristics of Dolce-Pharm's disposable gloves. Now you'll see a quiz on your screen to test your knowledge. The test is structured to include all of the information we covered to help you remember everything you've learned. Thank you for your attention.